My name's Ian Swift. I'm one of the exercise physiologists in cardiac rehabilitation. The talk today really is about sort of recovery post-heart events and the exercise component of that. So we're starting off by looking at the recovery process. So early post-discharge, obviously the recovery is an important aspect of your health and your sort of road to recovery thereafter. So it's important to seek sort of professional help, professional guidance in terms of appropriate exercise at this stage, and this is where our part of the team comes into that equation. So it's important to seek appropriate advice at this stage. And often, you know, having had heart problems, it's easy to start going into sort of inactivity and not being too motivated to pick up exercise where you left off. But that in itself can lead to problems. It can lead to problems whereby you can't sort of get back to normal activities. And unfortunately, it's a bit of a steady spiral into sort of inability to get back to sort of normal everyday activities. Physical activity is an important part of daily life, and it should be open and accessible to everybody. It should improve your well-being, it should improve your quality of life in the long term, but obviously with appropriate advice and taking things at the right sort of pace in your recovery process. Okay, so how do we become more active? And in the early stage of the recovery, these can be really quite simple things, you know, just moving more, taking steps to sort of park a little bit further away at the supermarket and walking that little bit further. And when we look at sort of some of the advice that's on that first slide there, we talk about sort of exercise after a meal. It's important, and this gets reiterated later on in the presentation, it's important to exercise at least an hour after a meal, making sure you have got sort of enough nourishment to be able to carry out the activities that you want to, but not while you're still digesting your food. So that's quite an important part of that particular slide there. But simple things like sort of moving more, taking the dog out more regularly, taking a ball out to throw for the dog maybe, just simple activities that can help to sort of improve your fitness along the way, and it's a sort of a cumulative process. So early post-discharge, you'll be in touch with the cardiac rehab team, and we look at the progressive walking plan. And what we do with this is we try and sort of set a level playing field so that, you know, it's an equitable advice to all people. So whilst we see sort of runners and swimmers and cricketers and people that just prefer to walk, what we do early post sort of recovery, early post discharge, is look at a progressive walking plan so that we know you're getting a sensible, meaningful level of exercise at this stage in your recovery. So the warm-up is important, and we'll talk about that a little bit later on in the presentation. But simple things like at week 1, we start off with a 5-minute warm-up. You may do 5 minutes in the middle part of your walk-in or your exercise, where you're stepping the pace out a little bit more, and then cooling down for a further 5 minutes to the end. So just a simple bout of exercise. This can be a little and often. It can be done more than once per day, but it amounts to a total of around about 15 minutes. At the end there, on that slide there, we'll see we talk about exertion, rate of perceived exertion, which is the RPE part there. And we're talking on a figure of 12 to 13, somewhere around there. There is a slide later on that talks about that, and I'll go into that in a little bit more depth in the next slide. So as the weeks progress, we're generally just increasing each bout of exercise by around about 5 minutes in that middle portion of the exercise, paying close attention to a warm-up and cool-down at either end of the exercise. And again, we'll talk about that in a little bit more depth later on in the presentation. When we look at rate of perceived exertion then, we've got a scale of 6 to 20. On this scale, 6 is no exertion at all, so that's entirely sedentary, sat down, just sort of metabolising at rest. On this scale, 20 is absolute maximal exertion, couldn't possibly make another step, and that's never our intention to push people to this extent. So that's just there as a representation as to sort of different levels of activity. So the majority of exercise that we're recommending is on this scale of 11 to 13. So 11 meaning light, light whereby if we thought about your breathing, you'd perhaps be able to sing a few bars of a song. And if we looked at 13, that would be the point where you could still hold a sentence, you could still put a meaningful sentence together, but sort of exerting any more than that would mean that you'd no longer be able to complete that sentence. And that's very well linked to what your heart and lungs are doing, and very well linked to an efficient level of exercise, which is achievable. And it's personal to you. These figures are very subjective, and they're useful to take away to use in everyday life, but as I say, very, very much down to the individual as to sort of what is 13 and what is 11. Looking now at the difference between activity and exercise, I think that's quite a wordy slide, that one, but if we look at the World Health Organization definition there, you know, any meaningful movement is beneficial, and it's going to give us long-term benefits in the future and as part of our recovery. So talking now about the exercise pyramid, which is quite a popular sort of reference and is easily achievable. What we're looking at, the tip of the pyramid there is reducing sedentary type activities. So simple things like if you're in the house for a length of time, getting up every half an hour, either to go to the bathroom or go to make a drink, you know, maybe even a little bit longer than that, perhaps up to an hour, but keeping yourself moving and limiting the amount of time that you spend in sedentary and watching television and these types of activities. Moving down to the bottom of the pyramid there, we're looking at activities where, you know, you can try and do things daily, try and move a little bit more. And as we referenced earlier in the presentation, we talk about sort of parking a little bit further away from the store if you go to the supermarket, parking the car a little bit further away from work or a little bit further away from the gym, or maybe even using different modes of transport, you know, so perhaps thinking about using your bike to get to your location, or thinking about taking a stroll and using more local shops and doing things that way. There are lots and lots of benefits of exercise which are very well documented, but you know, it has an effect on lots of different things, even very basic things like improving the way you sleep, improving the way your balance of your sleep occurs, and feeling more energized as a result of regular bouts of exercise. And we talk about that sort of, you know, perhaps runner's high, or the sort of the endorphins and so on that occur as a result of regular bouts of exercise. Other benefits of exercise then, I think if we look at this slide here and we think about the sort of different age groups, you know, to children, it's burning off energy, it's improving bone density, it's improving flexibility, it's these sorts of things. To adults, it's better mobility, it's more ability to do simple daily tasks, it's more ability to concentrate and focus and these sorts of things. And in older adults, it can be things like sort of reducing frailty, reducing occurrence of falls, these sorts of things. So you can see it has a benefit across a wide sort of spectrum of age groups as well. Looking at sort of guidelines and getting active, we talk here about sort of different temperatures. Now, these really we need to apply a sort of common sense approach to these guidelines. In the UK, it's not always going to be preferable to exercise below 16 degrees in terms of the outdoor temperature. That said, practically, if we waited for the temperature to be 16 degrees, we'd probably only exercise about 3 weeks a year. So we've got to look at sort of appropriate times of day, appropriate clothing. When the temperature is that little bit lower, we think about increasing our warm-up. So we allow the body to sort of prepare for the exercise a little bit longer. Maybe we have a face covering so that any cold air that's coming through is warmed as we go. But I think it's perhaps more important to focus on the higher intensity in terms of the temperatures. So 23 degrees and upwards. With that comes humidity. With that it becomes more difficult to exercise. It increases the intensity artificially. It can increase vasodilation, so some people will feel quite lightheaded, quite sort of dizzy when we've got temperatures of these extremes. So 23 degrees really is a cut-off there, and obviously bearing in mind the humidity and looking at the time of day at which you exercise. So, you know, in the peak of summer, you may be wanting to go out earlier of a morning, providing you've had your breakfast and your medication. Equally, you might want to go out later at night when the sun's starting to set, so it's not quite so warm, or pick times of the day when it's a little bit more breezy. So these temperatures can be quite important, particularly when we think about the types of medications we're taking and the different abilities we've got. So that's quite an important point, that one. And we do find ourselves, you know, extremes of temperature, we find ourselves cancelling exercise programs when gyms get too hot to exercise, purely for the safety of our patients and for their enjoyment of those exercise programs. So we mentioned earlier in the presentation about warming up and cooling down, and these are really important parts of our exercise. And it prepares the body in the warm-up process. It prepares the body, releasing natural chemicals throughout the system to open up vessels, to increase heart rate, to increase breathing rate, to allow you to sort of take on board the exercise that's to come. And equally, you know, if you went out in your car, you wouldn't sort of go straight out and rev the car to its maximum straight away. You want to get the oil around the system, you'd want to get the car prepared for what's about to come. And equally, we need this sort of process with our own bodies when we're preparing for different levels of exercise. And that's, you know, that's regardless of your ability as well. So we think about at least 5 minutes warming up. And it doesn't have to be anything fancy. If you're going out for a walk, you may take your first 5 minutes nice and slowly, nice and gently, and contemplate the walk that's about to come and the enjoyment and the benefit that you're going to get from that. Equally, when we've done the more intense part of our exercise, thinking about the RPE, the rate of perceived exertion, around about 13. We're thinking then about slowing the pace down, and again that uses the byproducts of exercise. It uses up the chemicals that we've used during the exercise process, helps to get rid of lactic acid, these sorts of chemicals that are within the system. We can help to sort of stretch and keep those muscles more supple and more able for further bouts of exercise. So your warm up and cool down are really important processes of this exercise, and you'll find that when we talk later on in the presentation about exercise programs, how important and how much we labour that process in terms of warming up and cooling down as an important part of your exercise progress. Okay, so looking at resistance exercise. Resistance exercise is an important part of a complete exercise program. It's equally as important as the cardiovascular exercise that we're trying to promote, and it's good in terms of functional capacity, in terms of being able to get up and down out of a chair without creaking and groaning, being able to sort of carry the shopping, the everyday groceries, being able to sort of engage with the children and play different activities with the children, and just general activities, resistance exercise has a lot of benefits, and it isn't about throwing heavy weights around a gym. It's about sort of getting that functional capacity and that power in the limbs, which we feel as though we tend to lose a little bit as we get that little bit older. Each year of our life over a certain age, so the ability to do resistance exercise and our sort of muscle tone starts to reduce. So to put that into a complete exercise program can help to combat that, and so it is an equally important part of your exercise as well as your cardiovascular exercise. And these activities don't have to be really taxing. They don't have to be things that you don't enjoy. They're not things that we want to force upon people. They're about doing more of the activities that you enjoy, more of the everyday activities that you enjoy, and getting that sense of satisfaction from achieving those activities. So things like the gardening, things like the walking, things like the swimming in appropriate circumstances, these are all things that are achievable, with the support of the cardiac rehab team. That said, we've got to use a little bit of caution in terms of overexertion and underexertion, and later on in the talk we talk about that sort of overexertion, underexertion cycle. But I think it's important to recognise the signs of overexertion. So this can be more shortness of breath than usual, feeling more dizzy than usual, on the odd occasion a little bit more chest pain or some chest pain, unusual or extreme fatigue. These sorts of things are all examples or things that might lead you to think that you've overexerted in certain circumstances. So again, it's recognising that and having the tools to equip yourself with sort of realising when you may have overexerted and learning from that process. So these next couple of slides can be a little bit busy, but the point that comes from them is very useful to take away. Firstly, looking at the over-exercise and under-exercise, or overactivity and under-activity cycle. This can be quite common, and we can all be guilty of it as well, myself included. And what we find is that on a really good day, we do everything. We mow the lawn, we take the dog for a walk, we go and do the shopping, we clean the house, we wash the car. And the following day, as a result, we've done all these things, everything looks great. But as a result, we don't feel so great ourselves. We feel quite tired, we feel lethargic, we may not feel motivated to do too much more that day. And so we rest for that day. The following day, we're feeling good again, so we're back at it. We're cleaning the car again, or we're off to the shops again, or we're off visiting relatives. We're doing more intense activity. We're walking for longer because we feel so good. And then again, the following day, we start to feel lethargic again. We feel tired again, and we start to recognise then that perhaps we did a little bit too much the previous day. We're having to rest again, and this sort of process takes you down a route that we want to try and avoid. What we really want to try and get from our exercise is a level amount of exercise which is achievable on most days, so that we can do the activities that we want to, we can get the enjoyment from them, but the exercise is one component of your whole day, and it doesn't take over the entire day and mean that you can't go about your usual daily activities. You can't go to work, you can't do the washing up after tea. It's these sorts of very, very basic things that over exercise and under exercise can have a real bearing on. So trying to get that level playing field where we're doing around about half an hour, perhaps up to 40 minutes of sensible level exercise within a nice rate of perceived exertion and within our own ability, then becomes more achievable. And to that end, we need to sort of set some goals and think about our pacing, and we can help with that. This is what we do in terms of our exercise programs, our virtual processes that we have. This is where we come into the equation to help you with your pacing, with your goal setting, to help you get back to usual activities, get you back to usual activities that you enjoy, and that are part of your sort of daily life. There are cautions with this. when we look at exercise, there are times when you perhaps might not want to be doing exercise, or it perhaps isn't sensible to exercise. This is often, perhaps you may be going through a particular sort of intense change in your medications. There'll be lots of things that are being changed to find the right levels for you. And at that time, whilst you might want to keep active, you might not want to be trying to get to your ultimate goal and pushing your training too much at this stage. Whatever types of activity you use, try and start slowly, try and start gently, and make things achievable so you're not setting yourself up to fail. And as I said to you before, trying to get a nice level playing field of exercise which is achievable and is comfortable, and means that you can carry on doing it and then get the benefits that we're looking for from that. So we're coming on now to the types of exercise and the types of training that we can offer you. There are several slides sort of relating to this. Firstly, we're looking at whether or not you're going to do a home-based exercise program, a virtual-based exercise program, which often is at home as well, or a supervised exercise program in a local leisure centre, in the hospital, or local sort of venues. What we do is we assess everybody individually. That can be done, sometimes it's done over the phone using specific questions that give us measurable outcomes. More often than not, this is done in the hospital, where you come in and we do an assessment and we look at sort of what your basic ability is like, what sort of goals that you want to get to, what sort of interests you have in terms of activities, and where you want to be. How this affects your daily life, your daily routine, what sort of job you might have, what sort of things you need to be able to get back to, and what you need to achieve. So all this sort of thing is taken into account on an individual basis with a view to getting you back to your usual self and sort of helping that process. So in more recent times, we've been looking at sort of virtual cardiac rehab programs, so looking at internet-based advice, internet-based workouts, things like YouTube, these sorts of exercises. We also do physio tools exercises, so we look at sort of paper-based exercises which can be more specific to particular sort of levels of mobility and ability, sometimes taking into account sort of past injuries or these sorts of things. So we've got the physio tools exercises that we use. The British Heart Foundation in the middle there, the lady in the middle, they do very good exercise programs that are very involving and very progressive in terms of sort of warming up and cooling down and variations therein of the different exercises that they offer. Equally, you'll see there Chris in the top right. That's in front of our wall bars in the gym, and he's demonstrating certain exercises there. So he has actually put together some workouts based around a circuit which sort of mimics very much what we would do either in a hospital setting or a community leisure centre setting, using varying levels of equipment. So what we try and do is make these videos as inclusive as possible. So if you've got weights and you've got gym equipment at home, then great, we can incorporate that into your plan. But equally, if you don't have those sorts of things, we can use things like resistance bands or even just everyday objects. So it may be a tin of beans or a bottle of water or a bottle of milk, or I have seen things where people use sort of the dog food as resistance. So there are lots of different things we can use around the home that don't need to be specifically expensive and bulky exercise items. In the bottom right corner there, Sophie is more energetic, and she's done some more advanced programs which some of you might like to take part in, and we've had some good feedback from those. and they're quite sort of nice and refreshing to see. Our supervised exercise programs then are generally supervised. What we've tried to do is cover the whole of the Wolverhampton locality, the whole of the city. So programs over at sort of Blakenall or at Aldersley or at Bilston, and then more locally in the hospital as well. Equally, we cover the Cannock locality, so we've got Cannock Hospital, we've got Cannock Leisure Centre, and later on there are sessions that we can look at perhaps Burntwood localities or Cheslin Hay localities. So we've tried to cover as much of our sort of Cannock and Wolverhampton sort of areas as we can. So we've got the low intensity exercises, and those make things more achievable and more accessible. They tend to be run more often than not in the hospital, and I'll come back to later on in the presentation as to sort of the process as to where you may end up in terms of your exercise program. There are ladies only exercise programs, so if the ladies in the audience would rather just be exercising by themselves, then that is achievable. Equally, because we do ladies only programs, there are programs that are just gents. A lot of our programs are mixed programs, but there are options depending on your preference as to how you want to do your exercise. The community-based exercise sessions are at different times, and we try and sort of accommodate people according to what time of day they want to exercise, where they want to exercise, and how they want to exercise, and with whom. That said, as you remember from earlier in the presentation, we talked about an individual assessment. Now, that individual assessment may necessitate you having to come into the hospital so that we can supervise you more closely, so that we've got greater facilities that we may need to access whilst you're exercising. So whilst we try and accommodate people as best we can in terms of their locality, their timing of their exercise, and with whom they exercise, there are occasions where there is part of the assessment that means that we think it is more appropriate for you to exercise on the hospital grounds, and obviously we'll have a discussion with you around that as a result. At the point at which you've had an exercise assessment, you can reasonably then expect to have a date to commence an exercise program, whether that be a virtual program or whether that be at your local leisure centre or in the hospital. Having done your exercise programs with us, having been with us for a number of weeks, be that 6, 8 or 12 weeks, sometimes even longer, we then look at a long-term maintenance phase of cardiac rehab. Locally, that is organised by Have a Heart, by the Wolverhampton Coronary Aftercare Support Group, which is our local charity which is attached to the hospital. And what we do is we refer you to one of our local instructors who coordinates the whole thing. And there are, again, virtual sessions that Jen that organises these sessions. There are virtual sessions on offer, there are paper-based sessions, there are YouTube workouts, and then there are sessions in the hospital and across the community in the local area around Wolverhampton. And this is all linked with the Wolverhampton Coronary Aftercare Support Group. In the Cannock locality, the process is very slightly different. What we do is we refer to nationally recognised qualified staff, which is a requirement of the sort of process. And locally in Cannock, we've got Cannock Leisure Centre, we've got Cheslin Hay, we've got Burntwood Leisure Centre, and then there are centres sort of moving further afield. So your long-term maintenance in terms of cardiac rehab can be an ongoing thing, and we've got people in venues at the moment that have been going to those venues for 15, 20 years upwards. So there's plenty to offer in terms of your long-term maintenance, having done the main part of your exercise with us. And these are things that you can sort of dip in and out of depending on how you want to sort of continue with your exercise. A lot of people will just carry on with their usual activities and go back to their own leisure centre or back to their own gym or their own private facility, or carry on with their usual activities, their cycling or their walking. And again, it's no one size that fits all. It's all about what is individual to you and how you want to get back to your normal sense of well-being, and hopefully beyond that as well. We are on email, we are on the phone, we're in normal sort of working office hours, but there is an answer machine available, so you can always leave messages if you need to get in touch with us. And the email at the bottom there is a generic email that we all access, and we're all able to access at different times of the day, so a response is never too far away.